Hi, I'm Dr. Jeff Burns from the University of Kansas Alzheimer's Disease Research Center, and I want to welcome you to our training on using blood biomarkers to assess dementia and cognitive impairment. It's an incredibly exciting time as we scale these new diagnostics into a variety of care settings. In this training, we focus on biomarkers that help detect the likelihood of the presence of amyloid in the brain. Now, the broader landscape of biomarkers is changing fast and includes measures of tau tangles and inflammation, among others. But just note that our focus here is on currently more actionable tests like p-tau217 that reflect the likelihood of amyloid being in the brain. And amyloid is more important now because it can be targeted by therapies. So by watching this, you'll learn when to order these tests, how to interpret them, how to communicate the results and understand their limitations, and then when to consider anti-amyloid therapies. And for clinicians here at the University of Kansas, I'm thrilled to announce that the p-tau217 test is now available within our system. You can order it in O2 by searching for p-tau217 or any aspect of the longer order name you see here. Thanks for joining and for your dedication to improving the care you provide your patients. Alzheimer's blood biomarkers are a groundbreaking advance, changing the landscape of dementia care by enhancing our ability to detect the disease early, guide our choice of new therapies, and provide a more confident diagnosis. It's essential to use these measures for the right patients, older adults with clinically significant cognitive changes. In the early stages of disease, misdiagnosis rates can reach 30 to 50%. What do I mean by clinically significant? A detailed clinical history that demonstrates clear cognitive changes that persist over time. It's particularly helpful if that history is corroborated by family members and in-office cognitive tests that objectively support some level of change, even if mild. For instance, take note when a patient or their family members report persistent memory lapses, such as forgetting conversations or frequently repeating questions. Difficulty managing finances or organizing daily tasks, especially when these challenges persist over time, can also indicate significant cognitive change. Imagine a patient who frequently forgets conversations and struggles with daily tasks. If these issues persist and are confirmed by family and cognitive tests, this patient is an excellent candidate for blood biomarker testing. It's this group of patients, those who exhibit clear, documented signs of cognitive decline, who stand to benefit the most from these advanced diagnostics. There are important limitations. As of now, we do not recommend these tests for individuals without evident cognitive change. The aim is not to predict Alzheimer's risk in asymptomatic individuals or to inform prevention strategies. That is still confined to the research realm. Instead, the focus remains on those already experiencing cognitive symptoms, reducing the risk of false or misleading results. By carefully selecting patients for blood-based biomarker testing based on well-documented cognitive changes, we enhance our ability to recognize and diagnose Alzheimer's changes early and proactively manage them. Interpreting Alzheimer's blood biomarkers is a crucial skill that can significantly impact patient care by enabling early detection, guiding interventions, and providing a more confident diagnosis. Alzheimer's blood measures offer a window into the brain and can be used to guide early detection and intervention when used in patients with significant cognitive changes. Remember, these blood measures reflect the likelihood of the presence of amyloid in the brain. The tests alone are not diagnostic, but they indicate the probability that amyloid, a hallmark of Alzheimer's, is present in the brain. What is amyloid? Amyloid is a key protein found in the brains of people with Alzheimer's disease. In a patient with documented cognitive decline, the detection of amyloid raises the likelihood that Alzheimer's is the cause. Interpreting a result varies with each patient, depending on their clinical history, the extent of cognitive impairment that's documented, and the blood measure value. For patients with well-documented dementia and clearly elevated amyloid, Alzheimer's is essentially confirmed. Proceeding with an Alzheimer's treatment strategy is the most reasonable path forward. There are now a number of disease-modifying therapies that have been approved by the FDA. On the other hand, patients with questionable cognitive symptoms require a more cautious approach, and you may want to observe them over time before ordering blood tests. For patients whose blood tests are indeterminate, near the cut point, we have less confidence in the accuracy. In these cases, consider gold standard tests like an amyloid PET scan to visually confirm the presence of amyloid, or a lumbar puncture to analyze the cerebrospinal fluid. This can offer a higher sensitivity and specificity for detecting Alzheimer's pathology. In cases where Alzheimer's biomarkers are absent or negative, explore other potential causes for cognitive decline, such as depression or medication effects or sleep apnea. Interpreting blood-based biomarkers for Alzheimer's demands a blend of science and clinical judgment to navigate the complexities of diagnosis and treatment with greater confidence and precision. A few things to consider. Did you know that 25% of older adults without memory problems have elevated amyloid? Amyloid alone does not cause dementia, but when it's observed in the context of cognitive decline, it greatly increases the likelihood of Alzheimer's. This is why it's important to test patients with confirmed cognitive decline. Also, recognize that false positives and false negatives are possible. Blood tests are not as good as lumbar puncture or PET scans, but overall have good sensitivity and specificity, so clinical context remains very important. Blood biomarkers are a revolutionary tool in Alzheimer's care, offering a less invasive and more accessible way to diagnose the disease earlier and more accurately. These biomarkers can simplify the diagnostic process. By detecting the presence or absence of amyloid, a protein that accumulates in Alzheimer's patients, these tests help you identify the underlying cause of cognitive decline, enhance the confidence of your diagnosis, and can open the door for pursuing new therapies aimed at reducing brain amyloid in patients with mild cognitive impairment and early Alzheimer's disease. In patients presenting with cognitive decline, these biomarkers can help distinguish Alzheimer's from other forms of dementia, such as frontotemporal dementia or Lewy body dementia. This differentiation is crucial for tailoring appropriate treatment plans and managing patient care effectively. In cases with an absence of Alzheimer's biomarkers, we should explore other potential causes for cognitive decline, such as vascular injury from stroke on MRI, depression, sleep apnea, and medication side effects. For instance, consider a patient with persistent memory or cognitive changes. If their blood test indicates a high likelihood of elevated amyloid in the brain, you can start discussing the potential for anti-amyloid therapies and consider a referral for those therapies. Early diagnosis empowers your patients and their families. It gives them the information they need to make informed decisions about their future care, explore lifestyle modifications, and potentially participate in clinical trials that could benefit them and future generations. By reducing diagnostic uncertainty and providing a clearer picture of the underlying disease process, blood biomarkers can significantly enhance your ability to help patients navigate the challenges of Alzheimer's disease. So in summary, blood biomarkers are transformative tools in Alzheimer's care, offering early detection, aiding differential diagnosis, monitoring disease progression, and supporting personalized treatment strategies. By integrating these biomarkers into your clinical practice, you can greatly improve the management and care of patients with Alzheimer's disease. Effectively communicating the results of Alzheimer's blood biomarkers is important for guiding diagnosis and treatment, and for providing patients with clear and actionable information. Interpreting Alzheimer's blood tests results starts with understanding what the test shows, the likelihood of amyloid protein in the brain. The result alone is not a diagnosis of Alzheimer's. It indicates whether amyloid is likely present, a positive result, unlikely to be present, a negative result, or unclear, an indeterminate result. So let's go through each of these scenarios. A positive result for amyloid suggests that a key component of Alzheimer's pathology, amyloid buildup, is present in the brain. This is important because when it aligns with progressive and persistent cognitive issues, it's consistent with the diagnosis of Alzheimer's disease as the cause of mild cognitive impairment or dementia. Naming the symptoms helps us understand their cause and determine the next steps. The path forward is now clear, and it's important to establish both a therapeutic plan and an action plan for the patient. Providing information on support groups, educational materials, and other resources can help patients and their families take a proactive approach. If the test is negative for amyloid, reassure the patient that this is good news, though it doesn't mean they aren't experiencing cognitive issues. Explain that further investigation or observation may be needed to identify the underlying issues. We should now consider other potential causes, such as vascular changes, sleep apnea, medications, or depression and anxiety. If a test is indeterminate, it means we don't have enough precision to be confident either way. If clinical suspicion of progressive cognitive decline is strong, consider more precise tests, such as a lumbar puncture for Alzheimer's biomarkers or an amyloid PET scan. Alternatively, we may need to observe for changes over time and repeat testing later to reach a more definitive conclusion. So in summary, effective communication of Alzheimer's blood biomarker results involves explaining the results, discussing their implications, addressing patient concerns, and providing support and resources. By approaching this conversation with empathy and clarity, we help patients understand their condition and empower them to make informed decisions about their care. While blood biomarkers offer a valuable tool for Alzheimer's assessment, it's crucial to understand their limits. First, blood tests are not a standalone diagnostic tool. They must be interpreted in the context of the patient's clinical history. It's important to use these tests on patients who are likely to have Alzheimer's disease, generally older adults, usually over the age of 55, with a history of clinically significant, consistent, and persistent cognitive issues. Testing in the most appropriate patients enhances the precision of these tests and their predictive value. We are not yet ready to use these tests in patients without documented cognitive issues, such as those concerned about a family history or wanting to understand their long-term risk. Did you know that 25% of older adults without memory problems have elevated brain amyloid? What it means to have amyloid in someone without cognitive issues and what we can do about it remains a topic confined to the research arena. For now, it's important to only test patients with confirmed cognitive decline. Second, like any medical test, there's a potential for false positives and false negatives, especially in cases where amyloid levels are near the cutoff point. Additionally, we have much to learn about how comorbid conditions such as kidney disease can influence the results. We know that someone with reduced kidney function can have falsely elevated results, so this should be an important consideration when interpreting results. Third, blood tests may not be sensitive enough to detect amyloid elevation in the very early stages of Alzheimer's disease. This means that a negative result doesn't rule out the possibility of early-stage Alzheimer's, and follow-up testing may be necessary. By understanding the limitations of blood biomarkers, you can use them appropriately and effectively in your clinical practice. They are a valuable addition to your diagnostic toolbox and should be used to augment, but not replace, careful clinical judgment and comprehensive evaluation. The landscape of Alzheimer's treatment is rapidly evolving, with recent FDA approvals of several anti-amyloid therapies offering new hope for patients. These therapies target amyloid plaques in the brain and can help slow the progression of the disease, especially when started early. Your patients with mild cognitive impairment or mild dementia who have a positive blood test suggesting the presence of amyloid in the brain may be candidates for anti-amyloid therapy. Some key facts about these drugs. They are not a cure. They reduce decline by about 30% over 18 months on average, and their long-term effects beyond 18 months are still unknown. These new drugs are monoclonal antibodies and thus require infusions once or twice a month at an infusion center. And these drugs have important risks. So they increase the risk of brain hemorrhage, requiring periodic MRIs, 4 to 5 in the first year of therapy for monitoring for safety. If you suspect your patient is a candidate for these therapies, consider referring them to KU's Anti-amyloid Treatment Clinic. This clinic improves patient access to these therapies by assessing eligibility, performing necessary tests like lumbar punctures or PET scans, discussing risks and benefits of the drugs, prescribing the medications, and conducting the essential safety monitoring. It's an exciting time in the field of Alzheimer's, with new diagnostics and treatments emerging that offer hope by slowing the disease's progression. By staying informed about the latest developments and engaging in open communication with your patients, you can help them navigate the complex landscape of Alzheimer's treatment and make decisions that are right for them. Well, thank you so much for joining us for this training on blood biomarkers. I want to close things out with a couple notes for KU clinicians. The p-tau 217 test is available in O2 at KU. You can search for it using any of the words in this order name here. And then in terms of sharing results with patients, we do have a smart phrase that does a good job of sort of framing the language around sharing results. You can take a look at that and use it with your patients or adapt it. It's .mem as in memory, p-tau results, mem p-tau results .phrase. So take a look at that. Now, this is a short biomarker training that you just completed, but we do have options to deepen your expertise in brain health through a 90-minute primary care brain health training program. This is tailored for primary care settings and offers 2 credit hours. So you can go to the website listed here to enhance your skills and stay at the forefront of Alzheimer's care. And lastly, I want to draw some attention quickly to a really important resource here called the Brain Health Biobank. And please encourage your patients to join this Brain Health Biobank. It's a very simple electronic consent that can be completed on any device. If they opt in, they are helping advance research by turning everyday clinical care into the research opportunities that we need by sharing data and biospecimens. So this is a great way also to hook them up with educational opportunities. We hook them up with a newsletter and invitations to brain health educational events and information on brain health. So you can use the smart phrase .bhb invitation, BHB as in Brain Health Biobank, or point them to the consent form online at kuadrc.org/BHB. So thank you for your dedication to patient care and for participating in this training. And we look forward to continued involvement together with us as we fight Alzheimer's disease.